Well, mental health issues dominated discussions at the National Association of Licensed Practical Nurses Conference underway at the Franklin Wilson Center of the University of the Bahamas today. Facilitator nurse Artomisia Moore of Washington, D.C. described critical to mental health first aid as some of the signs and symptoms before the problem worsens.
The signs based on what the diagnosis is, it could be sleeping, it could be a change in your appetite, it could be hallucinations, it could be delusions, it could be nervousness. So many different things, and it affects people in very different ways. To ask very simple questions. How are you feeling? And if they say, because a lot of times people say they have physical symptoms first, and we would ask them, how long have you had those symptoms? And should go see a physician so that they can try to get the symptoms taken care of.
Now, the workshop follows the catastrophic impact of Hurricane Dorian on Grand Bahama and Abaco last year, September, and it's anticipated nurses will be in a better position to assist hurricane victims once the workshop ends.
One of the most important things that I feel is that if we know someone has a mental illness, we need to use respectful language. Instead of saying the schizophrenic in the street, we would say the gentleman with schizophrenia, because it puts the onus of the disease on the disease and not on the person, because it makes you more apt to help them. If someone has a mental illness, they don't have any control over it and that they're suffering.